So we're going to talk a little bit about pain assessment and management in children. And this particular voiceover is just going to go over some basic theory about pain in children and how it may be a little bit different than that in adults. So the first thing I want you all to think about is that pain in children, an effective pain management is every child's right. For many, many years, it wasn't believed that children could experience pain or did experience pain because they, quote unquote, had underdeveloped neurologic systems. We now know that that is very far from the truth and that we are getting better and better at treating children for pain. And it is the right of every child to have that pain, and something that we all in pediatrics really fight for all the time. So pain in children, you all know what pain is, an unpleasant sensation. It may cause tissue damage, it may not, but there is an unpleasant sense. Acute pain is something that comes upon us suddenly. It's usually very short in its duration. It's usually caused by some single event and then results in some sort of injury or an exacerbation of a condition. There is immediate pain right at the time that the tissue is damaged, and then what generally happens thereafter is the inflammatory response, which in and of itself can also cause pain due to the pressure. And then that pain over time, as that injury heals, will get less. Chronic pain is pain that persists for greater than 3 months, and it's usually associated with a prolonged disease process. And one of the most common disease processes we think of here would be sickle cell anemia and sickle cell crisis. Those children have chronic pain over long periods of time. The other category where we can see that is children who have been diagnosed with cancer. It will affect the entire central nervous system, and they have increased neuron responsiveness to both painful and non-painful stimuli. So they're underlying much more likely to feel pain because they already have an underlying level of pain, if you will. Pain is nociceptive, normal processing of pain stimuli by tissue injury, or neuropathic, which is usually linked with central nervous system activity. If other stimuli is present, we may be able to alter painful stimuli. So if you would listen to the voiceover about some of the basic treatment, non-pharmacological treatments that we use, touch and massage is very effective. TENS units, those electrical stimulation units, those types of things can break or affect the transmission of pain signals and nerve signals, and it can alter the perception of pain. Untreated pain, well, this can basically, in a nutshell, lead to a chronic pain syndrome. It leads to pain memory and may alter perceptions and alterations in that pain pathway. So we definitely want to treat pain as soon as we know it exists for more reasons than just the immediate time frame, but the potential that we could cause long-term chronic damage. There are numerous physiologic consequences as a result of pain. Much of this should be a review for you. The same exists for children as it does for adults, respiratory-wise, basically respiratory distress in some respects. We will see an alkalosis, decreased oxygen saturations. They may hold on to secretions. They may not be breathing as deeply because things hurt. Much more rapid respirations we may see. Neurologic signs and symptoms, the sympathetic nervous system will have some overactivity. Metabolically, we will see an increase in metabolic rate and an increase in stress response, which then causes us to have an increase in hormone release. And one of the common stress hormones is cortisol, and so we will see increases in that. The immune system, we are less immune. Much more likely to deal with infection and inflammatory concerns if we have a depressed immune system. The GI system, decreased motility, they will have and a decrease in gastric secretions, and that's a problem. We certainly want our systems to continue to function. We don't want things to slow down. And altered pain responses or increasing pain sensitivity, which is what we talked about, which could lead to that chronic pain syndrome if we create a hyper alert state in our pain responses and neurologic system. So with children, things are a little bit different because we do have to take into account developmental stages. And we've been talking a lot about developmental stages, and so it's no surprise that it applies here. All ages of children do perceive pain. However, their understanding of why they may have pain, how they respond to it, and the memory they may have of that pain differs depending on the age and the developmental level of the child. Remember, we have talked about how about that 5-year-old or kindergarten, pre-kindergarten well child visit is the first time that children are beginning to connect needles and pain with the well child visit. There are a number of factors that influence the pain perceived by a child. How mature is that nervous system? Any previous pain experiences they may have had and are connecting, and what developmental stage they're at, are they capable of making that connection? Some of the responses are influenced by various things. So again, that memory of something in the past that has happened. Their temperament, remember we know temperament theory, the easy child, the shy child, the difficult child, that can have an impact on how they respond. The ability to control what is going on in some way can have an impact on the degree of pain that children are responding to. How well they respond to coping mechanisms, which again is driven by their developmental ability, any fears and anxiety present at the time. So if they have been built up an anxiety and fear as we're heading into it, they clearly are going to have a hyper response to that pain. We all do that. If I sat and worried about the fact that I had to have 3 shots at the end of this voiceover, I would be thinking about it, having anxiety about it, ruminating over it, and it would have an impact on how much pain I felt when I finally got those 3 injections. A child's pain can be expressed in a number of ways. Most often what we see is anxiety and anger. We may see kids who just stop eating or stop feeding, bottle feeding real well. They don't sleep very well, especially those children who are in a chronic pain state. They may not complain of pain, however, which is sort of the irony of this. So while they may have pain and we may be noticing those nonverbal means of showing us they're in pain, they may not be able to tell us they're in pain or complain of it for a number of different reasons, all having to do with their age and development. So they may not have the right vocabulary to help us understand it. They may believe that they need to be brave. We're going to learn as we learn about more individual age brackets and pain when we talk about this in class, that certain age brackets believe that it's important for them to be brave and to not complain about pain. They should be strong. Many young kids will assume that everybody must know they're in pain, and if nobody's saying anything, then they must have to buck it up and deal with that pain. So they don't say anything because they think we all know. And finally, they may fear that if they complain of the pain, the treatment we may use may cause them more pain. Maybe we'll have to put an IV in. Maybe we'll have to put a TENS unit on. Maybe we will have to give them a shot to help with that pain. So the fear of some pain that could be worse may prohibit me from complaining of the pain I have now. Finally, as I mentioned, the developmental level of a child will affect their coping strategies and how well they're able to adapt and cope to the pain. They may use various different means of coping, such as avoidance, diversion, postponement, all of those things we see, and we'll talk a little bit more about that in class. Remember, too, that there are cultural differences in pain perception and sensitivities. It does vary by race, and Black and Latinx, we do notice, have greater sensitivities to pain than whites in general have in terms of pain perception. And additionally, remember that culturally and socially, we are taught how we manage and deal with pain. And we do know that there are some cultures that are very quiet, very withdrawn, and how I would describe into themselves and into their own heads when they're in pain, versus others who are much more vocal, much more loud, much more expressive when they are in their pain. We need to understand those cultural differences and support them through that pain experience, coping, and hopeful improvement.